Dr. J. You're getting surgery tomorrow. How do you feel?
I'm okay. I know I'm in really good hands and I really don't have anything to worry about. Good morning, everyone, and happy Valentine's Day. My ride dropped me off a little bit early to the office today, so I've got a few moments to myself. What am I doing today? Well, I am doing a rhinoplasty case, and then I gave you a hint about something big that's gonna happen to me. I got a ride today, which means I'm not driving myself home. Why? Well, I'm having surgery today. I'm gonna have my upper eyelids done because my skin is really sagging and my brows are uneven. My left side tends to be a little bit lower and my brows also come down, which makes a very sad looking face or sad looking eyes. So I'm gonna have revision Asian upper eyelid surgery, and then I'm gonna have a direct brow lift because I would love to have a little lift to my brow and open up my eyes. Why am I doing it now? There's never a good time. I procrastinated long enough and I'm just gonna do it. So it was a decision made about a couple weeks ago and I'm going for it. Am I nervous? I'm not nervous at all. I've got the best surgeon. Dr. E is gonna do my surgery. I have complete confidence in him and know he's gonna do an amazing job. He does a beautiful Asian upper eyelid. So not nervous at all, excited for the results, not looking forward to the healing process. I will keep you guys updated, so follow along on social media. I'll see you after my surgery.
All right, I'm getting excited. We're getting ready to start my surgery for my sister. And OR is going to open up at 1:30. We're just turning the room over and been thinking about her case, looking at her pictures. I'm going to go mark her soon. So I usually mark the patient. It takes me about 30 minutes, sometimes slightly longer to mark, depending on what kind of surgery we're doing. Yeah, so markings for me are very important before going to the OR. So anyways, we're gonna medicate my sister and then I'm gonna mark and then we're gonna take her back and start. Okay, see you in there.
Yeah.
All right, we just finished surgery on my sister. It went great and I'm super excited. So it's just a matter of recovering and hopefully she'll have a fast, easy recovery. So, yep. All right, see ya.
Hi everyone, this is the first night after my surgery. I know my incisions look a little crazy, but everything should settle down very nicely. My left brow looks higher than my right brow, but my left brow was actually lower before surgery, so Dr. E compensated for that, and that should settle nicely. I've just cleaned my incisions, so they're super clean. I cleaned them with hydrogen peroxide and put ointment on them. And there's very little bruising. I've been eating lots of pineapples and papaya and taking my arnica forte. My eyes feel good, but I am gonna put ointment in it when I go to bed. Again, swelling's not bad. I anticipate that the swelling will be worse tomorrow morning. I've had no pain and I haven't taken any pain medications. I'm keeping my head elevated and icing my face. Look forward to chatting with you again tomorrow. Bye. Good morning, everyone. This is the day after surgery. I'm not looking so bad. I have some swelling, but it's not as bad as I anticipated. I don't really have much bruising right now. I'm not in any pain. Didn't even have to take a Tylenol after surgery. I did clean my incisions with hydrogen peroxide, and I used bacitracin on my brow incisions and erythromycin ophthalmic ointment for my upper eyelid incisions. My left brow has actually come down a little bit, so it's not as crazy as it was last night, and that'll continue to come down. I've been icing, keeping my head elevated, eating lots of papaya and pineapple, then taking my arnica forte and my antibiotics. So I'm doing really, really well. I just came in today to see my post-op. Otherwise, my plans for today are to be really chill and just ice, eat pineapples and papaya, and just kind of hang out. It's so rare that I get a chance to just chill out for an entire day, so looking forward to that. I'll see you guys tomorrow. Good morning, everyone. Today is post-operative day number 2. I'm looking pretty good. I was looking really good this morning until I hit myself right on my right brow with the hair dryer. It started swelling, but I got ice on it immediately, so now it's looking pretty good. It's just a little more swollen on this side. Otherwise, this morning it wasn't swollen. Usually we tell patients at post-operative day 2 and 3, that's when you're gonna have peak swelling. But my swelling is actually pretty good. I think it's because I've been really, really good about icing. As you can see, I don't think I'm gonna end up with any bruising. All I'm feeling right now is some tightness, but no pain. So haven't taken any pain medicine. But again, it's looking really, really good. I'm just gonna keep my routine of eating pineapples and papaya, elevating my head, icing. I did have yesterday, I did have some signs of dry eye where I felt like there was like sand in my eye. So I was really good about just keeping my eyes lubricated with ointment. And this morning they're feeling pretty good. So this is what I look like at post-operative day number 2. I'll see you guys tomorrow. Good morning, everyone. Today is post-operative day number 3 for me. I'm doing really well. As you can see, things are progressing nicely. I can tell my scars are gonna look beautiful. My swelling has come down and things have started to relax a little bit. I can tell because my stitches are poking me, so I can't wait to get those out. I am having a little bit of itching where my surgery was along my incision lines, and that's normal. That's a normal sign of healing. Today is gonna be more elevating my head, icing, applying ointment to my incisions, and also babying my eyes with artificial tears and ointment to just keep them moisturized. Other than that, I'm doing really well. I'm gonna be heading back to work tomorrow, so I'll see you tomorrow. Good morning, everyone. Today is post-operative day number 4. I am back in the office, so we'll see how today goes and how my eyes feel by the end of the day. I'm looking really good. I really didn't have bruising, but you'll see that I have like a faint hint of yellow. That's actually the last stages of bruising, so I really didn't have that dark purple bruising. But I must have had some because, again, I have the yellow, which is the last stages of bruising. There was a question of why I kept eating pineapples and papaya. Well, pineapples and papaya have bromelain in it, which helps decrease bruising and swelling. So, total firm believer in that. We also have our patients take arnica forte, which I have been doing. One thing you may notice today, I got a little more swelling here. Well, last night as I was sleeping, I didn't realize it, but I kind of slid down on my pillows and it ended up on my right side. So I have a little bit more swelling on that side because my head wasn't as elevated and I was also laying on my right side. So that should get better throughout the day and as I ice too. One other thing is, you know, my eyes by the end of the day feel they're a little irritated, like there's some discomfort. Again, we'll have to see how I do today because I'm not able to have keep ointment in my eyes all day like I have been doing. Yesterday I did try, instead of having some ointment, artificial tears. My eyes really didn't like that, and I finally realized why. I was using artificial tears that had preservatives. So I've now switched over to preservative-free artificial tears, and that's making a big difference. So I think if you're gonna do this, just get the preservative-free artificial tears, and you should be pretty good. So I'll let you know tomorrow how my eyes feel after a day of seeing patients and being on the computer. All right, see you tomorrow. Good morning, everyone. Today is post-operative day number 5. I'm progressing nicely. As you can see, my left brow is continuing to settle down. You may notice that I have a little bit more yellowing of my skin. That's just the last stages of bruising, even though I never had the deep purple bruise. You might also notice that I've got, like, it almost looks like I have eye bags. That's just swelling that is coming down because of gravity. So it's very normal for swelling to come down, and over the next couple of days we can see if some of this yellowing will come down onto my cheeks too, and that's completely normal. I did work yesterday. My staff was super nice to me and kept my schedule light. My eyes were okay, except that towards the end of the day they definitely felt a little more tired, a little more uncomfortable. So highly recommend that if you're gonna have eyelid surgery that you take a week off of work or keep things really light, because if I had to stare at a computer all day, I think my eyes would have definitely hurt a lot more. That's it for today. I'm looking forward to getting my sutures out tomorrow. So I'll see you tomorrow. Good morning, everyone. Today is post-operative day number 6. I just got my sutures out and it feels amazing. I never realized how irritating those sutures can be. I have to say, I look pretty good for being less than a week from surgery. I have to thank my wonderful surgeon for his skill and artistry. As you can see, my scars look amazing already. They're gonna heal beautifully. My eyebrows are starting to really even out nicely, and things are just settling. I'm so excited. I should have done this surgery earlier. I'll see you guys tomorrow. Good morning, everyone. Today is post-operative day number 7. I can't believe it was just a week ago that I had surgery. I'm thrilled with how everything is looking. My scars are looking great. I am trying different things on my scars. So in future updates, I'll let you know what works and what doesn't work. It's been a week now, and I usually tell my patients that ice doesn't help so much at a week, but I have patients start warm tea bag compresses. Teas have tannins in it, which are anti-inflammatory. So I haven't started that yet, but I am going to help decrease some of the inflammation. I'm not going to be doing daily updates anymore, but I will be doing at least weekly updates. So have a great weekend, and I'll see you guys next week. Good morning, everyone. Today is post-operative day number 12, and I'm feeling great. Over the last couple of days, I've started to wear a little bit of makeup, and it doesn't even look like I had surgery. My scars are looking amazing, and they're healing beautifully. Of course, I have to say thank you to my brother for the amazing job that he did. I'm also using on my scars plated, and then at night I've been putting silicone tape on my direct brow incision scars. So this is me at post-operative day number 12. I'll see you guys soon. Good morning, everyone. I'll be 5 weeks from surgery tomorrow. I'm feeling really good. I'm really loving the results of my surgery. I should have done this sooner. My scars are doing great. I'm putting plated on my incisions, and I'm also using silicone tape on my direct brow lift scars. And the scars are, again, amazing. So that's it for me. Since I'm over a month from surgery, I'll probably just check in monthly so that you guys can see my progress. Until then, take care, and I'll see you in about a month. Good morning, everyone. Today is 2 months from my Asian upper eyelid surgery and my direct brow lift. I'm feeling great, and I am loving the results of my surgery. Finally, I can look at photos and I look like I feel, if that makes sense to everyone. My scars are amazing. I don't even think you can really tell or see my scars. So I just wanted to check in and let you see how I look at 2 months after surgery. I'll check in with you guys in another month. Good morning, everyone. I'm 3 months post-op. I wanted to check in so you guys could see my progress and see how I'm healing. I'm loving how natural everything looks. I even forget that I had surgery 3 months ago. My scars are looking great. They're barely visible. I've gotten a lot of comments that I look younger, and when I tell them that I had my eyes done and my brows lifted, everyone's a little shocked because they can't really see my scars. Something that I've learned is, and I might be late to the game, but there are now these microblading eyebrow pencils that you can use to pencil in your eyebrows, and they are amazing. I love them. Anyway, that's it for today. I hope you guys have a great day, and I'll see you in a month.